Ka wadhi nyime oyudo ni nonro ma otim gi mbalariany ma Aga Khan yango ni dwaro nitiere mokasore mar chiwo arita makare ne jochiw thieth mamine seche magine ute mag thieth magitie. Nonro no yango ni jochiw thieth mamine owinjo mi arita motegno kinde mag midhiero mag tuoche. Nonro ma omi nying ni Women Health and their Economic Equity and Livelihood Status during Emergency Preparedness and Response yango ni sekta mar thieth ogeno kuom joma mon to kata kamano osebedo ka ing'iyo midhiero magikaloe kaluwore gi kit chwech margi ka wuoyo seche ma ogolo duoko mar nonro mane otim Kilifi.
The genesis of the research is we were responding to a grant call under our Women Rise initiative that is being funded by IDRC, CIHR and SSHR. Those are institutes within Canada that support research and development within that look at researchers within the low and middle income countries. And the Women Rise Initiative wanted to understand how COVID-19 affected the paid and unpaid healthcare workforce. So we grouped up together as Aga Khan University, and what we do primarily is health. So looking within the healthcare system in Kenya, we have then the two streams, that is the paid and the unpaid care workforce. So the paid healthcare workforce then became who are the CHPs at the time. Right now they're called CHPs, community health promoters, and paid cadre are the frontline healthcare workers.
I think it's really important that within our health systems we start seeing that men and women have different roles and responsibilities, and that the way as a society we construe those gender norms and roles do impact how healthcare providers, both men and women, can carry out their responsibilities both within and without of a facility.